Question. A client with acute appendicitis develops a fever, tachycardia, and hypotension. Based on these findings, the nurse should further assess the client for which of the following complications. So here, the client has acute appendicitis. As we know, what is appendicitis? It's inflammation of the appendix. And because of this diagnosis, the patient is developing fever, tachycardia, and hypotension. This indicates that the patient is experiencing some complications after developing appendicitis. So, based on these symptoms, we need to determine what could be happening in the patient's body. So, we have to assess for further complications. Now, the options are: first, we need to assess for deficient fluid volume; second, for intestinal obstruction; third, for bowel ischemia; or fourth, for peritonitis. So here, we need to understand the concept of what could happen after appendicitis. Since the patient has a fever and tachycardia, which means an increased heart rate, and is also experiencing hypotension, this suggests the patient may be developing some form of peritonitis. Now, how can we tell that the patient might be suffering from peritonitis? The signs of peritonitis include abdominal pain, abdominal distension, tachycardia, tachypnea, nausea, vomiting, and fever. In peritonitis, we can see that the patient may have a fluid volume deficit, which can lead to hypovolemic shock and hypotension. So these signs clearly indicate that the patient may have peritonitis. Therefore, we need to assess the patient for peritonitis. Now, let's talk about option number 1, which is deficient fluid volume. Deficient fluid volume can be seen in these patients, but fever and tachycardia are not typically present with just deficient fluid volume. So this is not the correct option. Option 2 says intestinal obstruction. Now, intestinal obstruction and bowel ischemia can occur after appendicitis. But we will not consider these options as the correct answer. Because with intestinal obstruction, the main cardinal sign would be decreased abdominal sounds. When we auscultate or palpate the abdomen, there will be decreased abdominal sounds and decreased abdominal activity. But here, since it's clearly mentioned that the patient is experiencing hypotension, this clearly indicates that the patient has developed peritonitis. So the correct answer is option number 4, which is peritonitis. No! Since the term appendicitis has come up, let's discuss what appendicitis is. First of all, let's look at what the appendix is. The appendix is a small pouch attached to the intestine. It's located in your lower right abdomen. When your appendix becomes blocked, bacteria can multiply inside it. This can lead to the formation of pus and swelling, which can cause painful pressure in your abdomen. Now, talking about appendicitis happens when your appendix becomes inflamed, usually due to a blockage. It can be acute or chronic. So, what symptoms might a patient with appendicitis have? So, appendicitis pain often starts as a mild cramping in your upper abdomen or around your belly button. Then it moves to the lower right side of your abdomen. This pain often begins suddenly. The pain will be severe and come on suddenly. It gets worse when you move or cough, and it's so intense that it can wake you up from sleep. It's severe and unlike any other abdominal pain you've ever had, and it gets worse within just a few hours. This means it needs immediate medical attention. Other symptoms may include loss of appetite, indigestion, nausea, vomiting, abdominal swelling, low-grade fever. Less commonly, you might have diarrhea, constipation, a constant urge to have a bowel movement, or trouble passing gas. So these are the symptoms of appendicitis. What could cause appendicitis? Now, in many cases, the exact cause of appendicitis isn't known. Experts believe that it develops when part of the appendix becomes blocked or obstructed. This blockage can happen because of a buildup of hardened stool, enlarged lymphoid follicles, intestinal worms, traumatic injury, or a tumor. So these can be the causes of appendicitis. Now, what are the risk factors for appendicitis? So first is age. People who are teenagers, meaning under 20 years old, are more likely to get it, but it can happen at any age. Okay, second is sex. Appendicitis is more common in males than in females. Family history. People who have a family history of appendicitis are at a higher risk of developing it. Okay, so those were the risk factors for appendicitis. Now, talking about complications, appendicitis can cause serious complications if it ruptures. Okay, so as we saw in the question, it can lead to peritonitis, abscess formation, and sepsis. A ruptured appendix can cause painful and potentially life-threatening infections. So that's everything about appendicitis. Now, let's move on to the next question. Post-operative nursing care for a client after an appendectomy should include which of the following? So, what is an appendectomy? An appendectomy means the removal of the appendix because of some kind of problem with it. So, after an appendectomy surgery, what should we include in the patient's care? First is administering a sitz bath 4 times a day. Now, here we need to understand and be aware of when and why a sitz bath is given. Basically, a sitz bath is given to patients who have any kind of problem or have had any kind of surgery in the rectal area. Essentially, a sitz bath is provided to promote healing after any type of perineal surgery. But in an appendicectomy, the incision is made in the lower abdominal area, so given a sitz bath isn't helpful in this case. Second is recording the first bowel movement after surgery. As we know, after surgery, bowel function should return. It's very important to monitor bowel movements because peristalsis decreases after surgery, so it's necessary to track recovery and the return of peristalsis. We always need to assess the client for bowel movements. So this is the first thing we need to do for a client after an appendectomy. So this appears to be the correct option. Option 3 says to limit the client's activity to just bathroom privileges. There's no need to restrict the client's activity to only bathroom privileges. All right, it should be allowed. There's no need to restrict bathroom access, so this isn't the correct option. Option 4 is measuring abdominal girth every 2 hours. Now, for a patient who has had an appendectomy, it's very important to check for abdominal sounds. We need to listen and palpate the abdomen for any abnormalities, but measuring abdominal girth every 2 hours isn't necessary in this case. So this is also an incorrect option. The correct answer is option number 2, which is noting the first bowel movement after surgery. Now, let's look at the next question. A client who had an appendectomy for a perforated appendix returns from surgery with a drain inserted at the incision site. The purpose of the drain is so in this case, the patient had an appendectomy because of a perforated appendix. All right, so the appendix was perforated. So here, the purpose is to prevent infection, which is why the drain is inserted. So we need to explain what that is. What is the purpose of inserting a drain at the incision site? First, to provide access for wound irrigation. Second, to promote drainage of wound exudates. Third, to minimize the development of scar tissue. Fourth, to decrease postoperative discomfort. So what is the purpose of inserting a drain at the incision site? So we need to remember here that a drain is always inserted to remove exudate. All right, we want to improve healing, we want to enhance the healing process. So to enhance healing, it's very important to drain out the exudates. That's why this is used to drain wound exudates. Now, talking about providing access for wound irrigation is not recommended for patients who have an incision. Okay, for a perforated appendix, because this can increase the risk of infection in the patient, so it's not recommended. Third, minimizing the development of scar tissue. A drain is not inserted to minimize scar tissue formation, so this isn't related to the drain. Fourth is decreasing postoperative discomfort. Now, the purpose of a drain is not to decrease discomfort. It's usually used to remove excess exudate and to improve healing. Therefore, option number 2 is the correct answer. Now, let's look at the next question. A patient with a history of an inguinal hernia is admitted to the hospital with sudden, severe abdominal pain, vomiting, and abdominal distension. The nurse should further assess the patient for which of the following complications. So here, the patient has a history of an inguinal hernia. So first, we need to look at what an inguinal hernia is. Now, the second thing mentioned here is that the patient was admitted because of symptoms like sudden, severe abdominal pain, vomiting, and abdominal distension. So here we know that the patient has a history of inguinal hernia and is experiencing symptoms like severe pain. So what's the first thing we need to assess? Okay, what complications should we be assessing the patient for? First is peritonitis. Second is incarcerated hernia. Third is strangulated hernia or intestinal perforation. Now, first of all, let's talk about what an inguinal hernia is. So, an inguinal hernia is a condition where soft tissue pushes through a weak spot in the abdominal muscles. The soft tissue is usually part of the intestine. Okay, so we can see here that wherever the area is weak, the abdominal muscles are weak. From that area, the intestine will bulge out. So this is called an inguinal hernia. Okay, so it's usually easy to see and feel the bulge, although not all patients can see it, especially if they're obese. So we have to remember that in obese patients, it might not be noticeable. Symptoms include pain, especially when a person coughs, bends, or lifts something heavy. Treatment may not be necessary unless the hernia is growing or painful. Surgery can repair it. So this is an inguinal hernia. Okay, now what are the complications? What should we look for? We have to assess the client for certain things. First is peritonitis. Now, when we talk about peritonitis, it means inflammation and infection of the peritoneal cavity. But this isn't the complication we need to assess for here. Here, the patient has an inguinal hernia. We know what's happening here. The patient's intestine has bulged out. And when the intestine bulges out, it can lead to a loss of circulation. When the circulation is cut off, it gets blocked. This can lead to necrosis and gangrene. Now, we have to connect this to the answer choices. The third option is a strangulated hernia. So we need to understand what this option is trying to tell us. We know that here we're suspecting a loss of circulation. And option 4 is intestinal perforation. So what complication do we need to assess here? Let's talk about an incarcerated hernia. So what is an incarcerated hernia? An incarcerated hernia is when a part of the intestine or abdominal tissue gets trapped inside the hernia sac. It's the bulge of soft tissue that pushes through a weak spot in the abdominal wall. If a part of the intestine is trapped, stool might not be able to pass through the intestine. Now, we need to remember that in an incarcerated hernia, there is no blockage of circulation. The blood circulation will remain intact. The only thing that happens here is that the hernia sac becomes irreducible and requires surgery. That's about incarcerated hernia. Now, talking about strangulated hernia, in a strangulated hernia, this is a life-threatening medical condition. Fatty tissue or a section of the small intestine pushes through the weakened area of the abdominal muscle, and then the surrounding muscle clamps down. So basically, here, the intestine gets clamped and twisted, which cuts off the blood supply. This is a life-threatening situation and needs to be evaluated immediately. Whenever the blood supply is cut off, it must be managed right away. Strangulation of the small intestine can lead to intestinal perforation, shock, or gangrene of the protruding tissue, all of which can be fatal. So we can clearly say here that we need to check for a strangulated hernia because this is a life-threatening situation. Now, talking about intestinal perforation, yes, it can happen here, but it's not the life-threatening situation. We need to assess the client's circulation, so option C is the correct answer. Now, let's look at the next question. A male client has just had an inguinal hernia repair. Which of the following instructions would be most appropriate to include in the discharge plan? So here, the patient had an inguinal hernia, and because of this diagnosis, the patient underwent hernia surgery, repair. So what is hernia repair? It's an operation for hernia. It involves opening the hernia sac, returning the contents to their normal place, closing off the hernia sac, and closing the opening with strong sutures. So this is about hernia raphe, so the patient has undergone hernia repair. And what is the most appropriate instruction we need to give the client in the discharge plan? First, turning, coughing, and deep breathing every 2 hours. Second, applying an ice bag to the scrotum. Third, putting on a truss before the client walks. And fourth, maintaining a high Fowler's position while resting. So as we know, the patient underwent inguinal hernia raphe. So we need to maintain a posture that puts less stress on the surgical area. On the surgical side, our goal is to minimize stress. So we can clearly say here that turning, coughing, and deep breathing are not recommended. This is completely incorrect because it'll increase stress on the surgical site. Also, whenever the patient coughs, advise them to hold a pillow or something soft over the area to reduce stress. So this is not the correct option. Option 2 is applying an ice bag to the scrotum. Now, we need to understand that whenever a patient has undergone herniography, it's common to see edema in the scrotum in male patients. Edema and pain are commonly seen in these patients. So we should advise the patient to apply an ice pack to the scrotum to reduce discomfort and pain in the area. So this seems to be the correct option. Option 3 says to apply a truss before the client starts walking. This option might seem confusing because a truss is obviously a helpful device. A truss provides support to the inguinal hernia site. But here we have to remember something. A truss is recommended when a patient hasn't had surgery. If a patient has an inguinal hernia, then a truss is advised to support the bulging area. But in this case, surgery has already been done, so there's no need to recommend a truss. All right, so this is also not the correct option. Option 4 is maintaining a high Fowler's position. In the high Fowler's position, we know that the angle is 90 degrees. Okay, so this will put stress on the inguinal area, so we don't recommend this. So what we do recommend here is applying an ice pack to the scrotum. This is a picture of a truss. It's worn by men to support the inguinal area. A truss is a type of surgical appliance, especially used for patients with hernias. A truss provides support for the herniated area. It uses a pad and belt setup to keep it in the right position and should be put on before getting out of bed. So that's everything for this question. Now let's look at the next one. After an inguinal herniography, the nurse should carefully assess the male client for which of the following complications. Okay, so after inguinal herniography, after inguinal repair, what do we need to assess in a male client? So what complication do we need to watch out for? First is hypostatic pneumonia. Second is deep vein thrombosis. Third is paralytic ileus. And fourth is urinary retention. So we need to understand the concept here. What exactly is the issue? What complication can occur after an inguinal hernia repair in a male patient, specifically in men? So let's look at the correct answer. Here, the correct answer is urinary retention. It's been observed that after inguinal hernia repair, there can be some effect on urinary retention because the ureter may be compressed during surgery. So we always need to assess the client for urinary retention. Hypostatic pneumonia, deep vein thrombosis, and paralytic ileus are complications that can happen after any surgery. These are not specific to inguinal hernia. They are complications, but they're general complications that can occur with any surgery. For inguinal hernia, urinary retention is a specific complication. So that's what we need to assess in the client. Now, let's look at the next question. A nurse is caring for a client with Clostridium. So here, the nurse is caring for a client with Clostridium difficile. Which of the following should the nurse do to prevent the spread of infection? Okay, so the client has a Clostridium difficile infection. So to prevent further infection, to stop the spread of infection, what does the nurse need to pay attention to? Select all that apply. First, wear a particulate respirator. Second, wear sterile gloves when providing care. Third, cleanse hands with an alcohol-based sanitizer. Fourth, wash hands with soap and water. Fifth, wear a protective gown when in the client's room. So we need to say what measures we need to take care of. So we need to understand here that Clostridium difficile is an organism that has developed very resistant and highly dangerous strains. Now, the precautions that need to be used for Clostridium difficile infection are universal precautions, okay? Most importantly, hand washing, wearing personal protective equipment, and careful use of antibiotics are critical actions to stop the spread. Clostridium difficile is not spread through the respiratory tract, so a respirator or mask is not needed. Alcohol-based hand sanitizers don't kill Clostridium difficile spores, so soap and water should be used to kill the spores. Sterile gloves are not needed to provide care. Clean gloves can be worn, so in this case, the correct options are option 4 and 5. Washing hands with soap and water will kill the spores, and wearing a protective gown when in the patient's room is necessary. As a standard precaution, cleaning hands with alcohol-based sanitizer is not recommended because it will not kill the spores. Sterile gloves can't be used here because this can be done with a clean procedure only. And a particulate respirator is not needed because it does not spread through the respiratory tract. So option 4 and 5 are the correct choices. Now, let's move on to the next question. The nurse discovers that the client's TPN solution was running at an incorrect rate and is now 2 hours behind schedule. Which action is most appropriate for the nurse to take to correct the problem? So here we can see that the patient is on total parenteral nutrition. We know that total parenteral nutrition will increase the glucose level in the body. It is used to provide nutrition to fully meet the patient's nutritional needs. Now, we can see here that the rate is 2 hours behind, which means the solution was not being administered appropriately. It was being given in a smaller amount. So what is the most appropriate thing we should do here? First is to readjust the solution to infuse the desired amount. Second, continue the infusion at the current rate, but run the next bottle at an increased rate. Third, double the infusion rate for 2 hours. Fourth, notify the physician. Now, we have to remember here that before changing the rate, we always have to notify the physician. Because we are administering total parenteral nutrition, and TPN can lead to complications like hyperglycemia. If we double the rate, this can cause a sudden increase in glucose levels, which can be life-threatening. So we cannot readjust or change the rate before notifying the physician. So the first thing we have to do is notify the physician about this. Because even a 10 or 20% change in the rate can lead to severe hypo or hyperglycemia. So option number 4 is the correct choice. The other options are only valid if we receive a prescription. Now let's look at the next question. The nurse is supposed to give 500 milligrams of ampicillin orally to a patient with a ruptured appendix. The nurse checks the capsule in the patient's medication box, which is inside the patient's room. The dosage of the medication isn't labeled, but the nurse recognizes the color and shape of the capsule. What should the nurse do next? So in this case, the nurse is about to give ampicillin, which is an antibiotic, by mouth. Now, the situation here is that the nurse is checking the capsule, but the medication isn't labeled. So what should the nurse do in this situation? First option, administer the medication to maintain the drug's blood levels. Second option, ask another registered nurse to verify that the capsule is ampicillin. Third option, contact the pharmacy to bring a properly labeled medication. Fourth option, notify the unit manager to report the problem. So here, even if the nurse can recognize that this tablet is ampicillin, even if she knows for sure, we should never give it to the patient if it isn't properly labeled. because the color and shape of the medicine could look like other medicines. So we can't say for sure that this is the exact medicine, so we always have to contact the pharmacy to bring a properly labeled medication. That would be the correct step. We shouldn't ask another registered nurse to verify it because she could also be wrong. Okay, we shouldn't give the medication just to maintain blood levels because it could be a completely different drug. Notifying the unit manager to report the problem, we have to give the medication on schedule. So if you notify the unit manager, it'll take too long. So the right thing to do is to contact the pharmacy and get a properly labeled medication. So option number 3 is the correct choice. Now let's look at the next question. On the second day after an abdominal perineal resection, the nurse notices that the wound edges are not together and half of the incision has come apart. What should the nurse do first? So we can see here that the patient had an abdominal perineal resection. We've talked about this before. Now, after this surgery, the nurse notices that the wound edges are separated and not coming together, and half of the incision has split open. Now, this clearly indicates wound dehiscence. Okay, so that's what we're suspecting. We can clearly see that this is wound dehiscence. So what's the first thing to do? What action does the nurse need to take first? First, flush the wound with sterile water. Second, apply an abdominal binder. Third, cover the wound with a sterile dressing moistened with normal saline. Fourth, apply strips of tape. So whenever there is wound dehiscence, whenever the edges of the sutures are separated, okay, a part of the body may bulge out and that body part can dry out. So to prevent dryness and avoid further complications, always cover the wound with a sterile dressing moistened with normal saline to maintain the normal temperature and moisture of the body part. So that's the first thing we need to do. We do not need to flush the wound with sterile water at this stage. Okay, so that's not the correct option. Apply an abdominal binder. So if wound dehiscence has occurred, the first thing to do is cover the wound with a moist, sterile dressing. After that, we'll resuture the wound. Then we can apply strips of tape, and after that, we can recommend an abdominal binder. So these things can be done afterward, but the first thing here is to cover the wound with a sterile dressing moistened with normal saline. Now, let's move on to the last question of this video. A client has received several different antibiotics and is now experiencing diarrhea. The physician has prescribed a transmission-based precaution. Which of the following types of precautions would be most appropriate for staff to use? So here, because of the use of various antibiotics, the patient is now experiencing diarrhea. The physician here has prescribed transmission-based precautions, so we need to follow those precautions. So what is the most appropriate precaution that we should apply here for all personnel to use? First is airborne precaution. Second, contact precaution. Third, droplet precaution. And fourth, needle stick precaution. So which precautions should we use here? So we need to remember that airborne precautions are required for patients with suspected or confirmed pulmonary TB, chickenpox, or other airborne pathogens. So airborne precautions are used for airborne pathogens. So that's not what we'll apply here. Second is contact precaution. Contact precautions are used for organisms that spread through skin-to-skin contact, like Clostridium difficile, as well as antibiotic-resistant organisms. So we can see here that due to various antibiotics, the patient has developed diarrhea, which means antibiotic resistance has developed. So for these patients, it's very important to use contact precautions. So contact precaution is the correct option. Talking about droplet precautions are used for organisms like influenza or meningococcus that can be transmitted through close respiratory or mucous membrane contact with respiratory secretions. Fourth is needle stick precaution, which means bloodborne precaution. So the most important aspect of reducing the risk of bloodborne infection is avoiding percutaneous injury. Okay, extreme care is essential when handling needles, scalpels, and other sharp objects. but this isn't related to diuretics. So the key word here is antibiotic. Because of various antibiotics, the patient has developed antibiotic-related issues.